we're trained in our residency and our med schools to not question the system. We are trained to look at the attendings and the doctors above us like they are demigods, and they can dish out either punishment or a world full of riches and BMWs and beautiful spouses and nice houses, and we can be brought into the country clubs and be the doctor that is part of the community. But those guys above us, they hold that key. And we have been told that from day one, and we are terrified to go against it.
I guess it sort of goes without saying, they have strong motivation not to push any alternatives regardless of their merits.
Oh, absolutely. And, the interesting thing is you ask, what is the pressure from the other side? What's their motive? And the motive is almost universally financial. The smart doctors, in terms of maintaining their careers, being, quote, smart, what they learn early on is they recognize that the right decision is the decision that, greases the wheels of the healthcare system. It keeps the hospital administrators happy. It keeps the insurance companies happy. It keeps their practice partners happy. And that's what clouds their decision making. They no longer think about the individual patient. Patients come and go. And they realize pretty quickly, if one or two patients are disappointed with their care, there's really no bad outcomes for me if one or two patients are disappointed with their care. But if I disappoint the hospital administrator, if I disappoint my colleagues in town, if I disappoint the medical board, those consequences are irreversible and devastating. So they're willing to throw a patient or two under the bus to keep the other people happy because that's what they feel they have to do. I'd give a piece of advice to your listeners about a very simple thing they can do. I'm a surgeon, so I can talk best about things they can do if they're offered a procedure, told to have a procedure. And actually really any disease, even if they're offered a medication. What I would recommend everybody to do, and I talk about this with my patients I advocate for. I say if you are given a new diagnosis, if you are offered a drug or a procedure, the very first thing that you should ask your doctor is, can you please explain to me what would happen to me and what are the consequences, what is known about this disease if I choose to do nothing? And it's amazing how many doctors will not answer that question. My most recent, just a couple days ago, my most recent advocate client that consulted me because she stopped menstruating, and she's in the age group that it's a normal time to have menopause. And she stopped menstruating, but she was still in her 40s. And after 3 months of not having a period, the major reason she went to her doctor is she wanted to know if she had the potential of getting pregnant still, because her and her husband wanted to know that. They weren't really interested in having any more kids. She didn't know if she still had the ability, but they kind of wanted to know. Well, she went into her OBGYN, and her OBGYN, based on that history alone and no physical examination, said, oh, you know what you need? You need hormone therapy. She put her on hormone therapy, which she had never been on before. Now, mind you, when she went in, she didn't have any pain, any problems, anything, just the menstruation stopped. She puts her on hormone therapy. The woman starts bleeding erratically during the month, and she starts having a lot of pelvic and abdominal pain. So she goes back to her OBGYN and says, since you've put me on these hormones, this is what's happening to me, what should we do? And the OBGYN said, stay on the hormones, let's schedule you for surgery to take out your uterus. Now, luckily the woman listened to that, and it just didn't make a lot of sense to her, so she contacted me and said, can you look over my medical records and kind of tell me whether this makes any sense or not? And I was appalled. I was like, really? We give people medication that cause a disease, and then we recommend surgery because her uterus doesn't like the medication? That's insanity. But that's what's happening. Oh, tell me about it. As an advocate, I'll have some people contact me. I ask for their medical history and the list of their doctors and the list of their diagnosis and the list of their drugs and their supplements. And sometimes I'll get a patient who has 15 drugs on board. And when I start asking them, well, why are you on this one? Well, I'm on this one because they told me I need to be on this one because of this one. Why are you on that one? Well, I'm on that one because I need this one because of this one. Well, why are you on that one? Well, I don't remember anymore. And I'm sitting there going, I don't know which drug is causing. What did they treat initially, and what's the drug on board to treat the treatment? I'm like, this is getting nuts. I can't even sort through it as an MD. I just kind of throw up my hands and go, I'd like to help you, but this is a really complex situation, and I'm afraid to pull something out. It's kind of like having a house of cards, and I'm sitting there going, I don't know which card's keeping this person propped up right now. And I can't really recommend them just stopping that one or that one because, this is now a very complex physiology. It's been artificially created, and you don't know what's going to happen to these people. And usually it's not the same doctor who's put them on all these drugs. They have these things now called bioethics boards that they sweep in and they review these cases, and they have full authority by the state to mandate procedures, especially on minors, despite the parent's wishes. And if the parent disagrees with the doctor can send it to the hospital bioethics board, and the bioethics board has the authority to say to the parent, we're overriding what you want for your child. This is now a bioethics decision, and you don't have any say in it. Because to argue with us is tantamount to abuse and neglect of your child, and you're going to stand down and let us do what we want. Mm-hmm. And the bioethics board sounds like a good idea. I mean, yeah, it sounds great. Let's have a bioethics board. Some ethical people who are helping make ethical decisions for patient care. That's not what a bioethics board is. It is literally the secret service or the KGB of hospitals. I mean, it's spooky. Well, and the really silly thing, especially when we talk about vaccines, is just this. What they'll typically tell the parents who don't want to vaccinate their children is you have to vaccinate them because they're going to put all the other children at risk.
Mm-hmm. Yeah.
Well, if the vaccines work and all the other children are vaccinated,
there's no risk, right?
then I can flood the school with tetanus, and no one's going to get hurt, right? If these things work. So you got a couple kids who aren't vaccinated, and the rest of the people are vaccinated. Where's the risk?
It's like if they really believe in these vaccines, then what's the problem?
Exactly. It's a very interesting question, and they get very uncomfortable when you start asking it.